I'll call our meeting to order today.
Eastern Standard.
Roll call by the clerk.
Francis Duncanson,
Here.
John Montgomery's,
Here.
Here.
Pam Garden. Here. Lee Duncan,
Here.
Bill Leva.
Here.
Rita McKee.
No.
Here. Here.
Yes.
And Dr. Lagus.
Here.
Wait. I don't know if you're hearing me.
We got a quorum. So with that, moving on, I'll entertain a motion to approve.
I
the agenda.
motion to approve the agenda as presented.
Second.
Okay, any discussion? With that, all in favor, say aye. Opposed, same sign. And the agenda is approved. Motion carries. Moving on, approval of the minutes from the October 8th, 2024 meeting. I'll entertain a motion to approve the minutes.
I move to approve the minutes of the previous meeting.
Second. Okay, motion's been made and seconded to approve the minutes. Any discussion? With no discussion, I'll call for vote. All those in favor say aye.
Aye.
Opposed, same sign. And the motion carries. Moving on to item number 5, public comment. Do we have anyone today who would like to make any public comments? And it appears we do not have anyone for public comment. So moving on to agenda item number 6, receipt of information from supervisors not seated as committee members. Do we have any supervisors either in person or online who have any comments for us? It does not appear that we do. And so with that, I will move on. So item number 7 is our upcoming presentation from child support.
It is now.
Unless Nikki's on, I think that'll be me.
Okay.
I don't know that I have a whole lot of information. Here wrapped up. Our numbers were pretty good compared to last year. We, I believe we're up in all of our different categories except for one, and I think here on the ongoing child support that we brought in. So everything is still going really well. Our case numbers continue to go up. I think they're only up maybe 10 from last month, but we're still increasing our caseload. And so everything's humming along. Not a whole lot else.
Do we have any questions or comments for Joe about child support? I know those numbers, when we have been presented with them before, were pretty impressive as far as our rates of collection and what we do there. So I just kind of want to give everybody a shout out who has anything to do with that. Thank you very much.
We won an award. I think we gave an update on that earlier this year for having our percentages at certain rates across all of our categories and having increased from the year prior. So we won that award last year, I believe. I think we will be on pace to win it again this year. And it is always the year prior. So because we just finished our year, we'll find out whether or not we met all of the parameters sometime in spring. So
Nothing wrong with a little bit of recognition for a job well done.
yeah, so our director's doing good work.
Yes.
I just go to court.
Thanks, Rob. So with that, item number 8 is our update and presentation from the Veterans Service Office. Annie?
Good morning.
Good morning.
I don't have much for updates either. One thing I do want to talk about is the Patriot Guard Riders of Wisconsin are again putting on what's called Operation Christmas Angel. So like for Health and Human Services, if there's any veteran families that are identified that might benefit from participating in this program, send them my way because we can get them the application and get that submitted. So essentially it's for Christmas gifts. So anybody, any veterans, send them our way. And then as far as like numbers and things like that, I just want to share where we're currently at for year to date. So year to date, we've had 211 veterans with favorable decisions for disability compensation from the Department of Veteran Affairs. And those retro payments so far are totaling $1,688,000. So just to give you an idea of where we're at this year compared to last year, for the entire year of 2023, we had 100 favorable decisions for veterans totaling $1,036,000. So we more than doubled essentially our favorable decisions and our workload. It's been a very busy year with the expansion of the PACT Act. So we're still seeing new veterans coming in that have never utilized any of their VA benefits. So they're starting to get enrolled and taking, using those benefits that they're entitled to. So that's all I have.
Well, thank you very much for that. I
Absolutely.
just want to mention that a lot of our communities here in Polk County do excellent Veterans Day recognition programs in our schools and in our communities. And I don't know if you get a chance to attend those, they are inspiring. Johnny?
I don't know if you knew this, in the St. Mary Cemetery in Farmington. They just finished a Veterans Memorial. The dedication is gonna be this Sunday at the cemetery at, I believe 10:15. And there'll be a reception in the church basement. If you go down Highway 35, you'll see around the flag, there's a sunrise lawn. Did all the landscaping and built it, and they donated that, and a lot of their workers. And I think it's about a $30,000 to $40,000 monument.
Oh, wow.
One donor donated 10,000, another donated 5,000.
Yeah, I've seen pictures of it. So I'm a member of the Osceola American Legion Post, and they're gonna be there. I can't make it on Sunday, but yes, they're gonna be there, as far as like our color guard for that.
If you're going, and it is lighted, they trenched light there, and so if you go down Highway 35, look to the right and you'll see the nice lighted flagpole. And then they've got they got kind of a monument there with all the veterans that gave their life.
Mm-hmm.
Pretty outstanding for a little community.
Absolutely, yeah. And so another update for that down in that area, like the St. Croix Valley Veterans Memorial in Osceola. I believe they now have they have electric, and I think they're prepped for water. I think water will still be put in this year for
That's very
the sprinkler system. Yeah, and there's stones still available down there. If anybody wants to purchase a stone, it doesn't have to be for a deceased veteran. It can be any living service.
like a regular brick size, and you can purchase a stone.
Yep, and they have larger ones too. The bigger the brick, the more expensive they are, of course, but all those proceeds go to that veteran memorial.
Mhm.
Mhm.
Awesome. Thank you for that update, John, for that information. That's something that hopefully some of us get a chance or.
Yeah, I hope there's a good turnout.
Yeah. Sounds great. Are there any other questions or comments or anything today for Andy? Nope. Okay.
Thank you.
Thank you very much. With that, we will move on to agenda item number 9. It is a resolution 53-24 to support the increase of funding for nutritional programs for the elderly. So this is a resolution that was passed by the ADRC board that is going through this committee onto the county board. In looking that over, it's been, I think, close to about 40 years since there's been any state increase in the funding in this program. So this is just some encouragement to let the state know that we would appreciate some additional funding for that.
I move we pass that on to the county board and hopefully a unanimous support.
Is there a second?
Second.
Okay, any discussion?
Is that with recommendation then?
Yes, I believe that was part of John's motion. Okay, and if there is no discussion, I will call for a vote. All those in favor say aye. And opposed, same sign. Okay, and with that, the motion carries to pass that along to the full county board. Moving on to agenda item number 10, resolution 5224 to support funding community support program and crisis services. Tanya, do you want to speak to this a little bit?
So I gave information on this last month. It is a resolution being sponsored out of Wisconsin Counties Association and endorsed by Wisconsin County Human Services Association. I believe that this was on the budget docket last round, and it did not make it into the budget. So this is support for fully funded community support programs and crisis programs. These are underfunded mandates that we have. We only get the Fed share of the Medicaid payment. We pay the state share. We pay for full cost upfront. We have to claim all of the services and get the Fed share back from the state through our MA billing, Medicaid billing. So what this would do is put that the 40% that we're funding back into our pockets so that we could fully fund those two programs. It's been underfunded for a long, long time.
Is there a dollar figure with this?
It would be for us to be able to figure out a dollar figure would take a little bit of calculating, just because of how we do our budgets. Crisis services, and I don't know what they mean by crisis services, if that's fully funding Winnebago placements, inpatient placements, or if it's just the county work that's being done. So I don't know the exact dollar number
So
to,
this won't be on our Tuesday night.
no, we want this to be passed up to county board for support to go to the governor's
Right,
office.
but there's
Yeah.
no dollar figure in our county budget, right?
We've already factored it into our budgets as it is, so we are paying the 40% of the state share.
This is basically a support resolution
Yeah.
from the Wisconsin County Association.
I thought it
from the
was. I
Conversation.
want to clarify that.
Mm-hmm.
I just have a couple of questions, just curious, like how this all works. So you get Polk County pays the 40% of the state share. So somewhere then there is a number for Polk County to figure out to come up with that 40% number. And I'm not trying to challenge that,
Yeah.
the numbers, I'm just saying. So then, but then Polk County then applies that back to the state. And then you only get a percentage of what you've applied for.
Right, we pay full cost up front.
Yep.
And then by the number of units that we are billing to the Medicaid program, we get back the 60%.
You get
So-
60% of the 40%.
Approximately.
I'm just
Mhm.
trying to
Mhm.
so in essence, we're 20. Yeah, 60%. I can't,
40.
I can say, 60% of 40. I'm not going to do the math really quick in my head, but so Polk County is picking up that percentage. So when you say unfunded mandate, that's what I'm just trying to figure out. So when it comes,
Underfunded, yeah.
right, or yeah,
Mhm.
I'm sorry, underfunded. You did say underfunded. So it's about that 20% number, not exactly, but anyways, okay. Thank you. I was just trying to follow the numbers a bit and how that all works. So I appreciate that.
No problem.
Are there any other questions or comments for Tanya or about the resolution? Thank you for that explanation. That stuff gets a little technical sometimes. Okay, and with that, I'll entertain a motion to approve with or without recommendation of the county board resolution 52-24.
I'll second it.
Oh, actually, I wasn't making a motion. I was looking for a motion, but I can make the motion. So I make a motion that we pass along resolution 52-24 and forward that to the county board with a positive recommendation to approve.
And I'll second it.
Okay. Any discussion? With that, I will call for a vote. All those in favor say aye.
Aye.
And opposed? With that, motion carries. Agenda item number 11, update regarding housing. Mo, would that be you?
Yes, currently there's no update. We have had no other actions for the housing program at this point.
Okay.
So we still have the one.
Okay, good to know. Thank you. Agenda item number 12 is our communicable disease report. And yes,
These are toxic.
I'm good for Helen since she is not here right now with us. So of the things we report for the month of October, in Polk County, we had 4 cases of chlamydia, 4 hospitalizations due to COVID, 10 cases of Lyme's disease, and then 2 cases of pertussis or whooping cough. But for Wisconsin, there's been 1,451 cases as of November 1st. And with pertussis, it is a category 1 disease. So the person who has it does have to isolate, but their contacts do not quarantine. That's all I have. So
you said there were 2 cases,
2 in Polk County, yes.
2 in Polk County.
Mhm.
And Helen said that the 2 were repeat visits to the doctor's office, second and third time asking for that test specifically, chronic coughing both times, and then on the third time, probably after we sent out the notice that the pertussis was increasing in the state. So,
Oh.
so just we want people to be aware of the fact that it is here and it is spreading, and to advocate to be tested if most likely a kid is having a cough that won't go away or a sickness, illness that won't go away.
So have you let the clinics and hospitals in the county know about this?
Yes, we have sent patients to all of the local partners as well as the schools. And I think the schools put it out to their families as well.
Dr. Lagas, did you have any public health?
Yeah, I just have a few comments. The COVID situation is improving. There are less people. There's still about less people in the hospital. We're still losing about 1,000 people a week dying from COVID throughout the United States, mostly in people 65 and over. Many of these are non-vaccinated. And so it's, there's a new COVID booster that's available. And I listened to Dr. Osterholm's podcast last night, and so he's now saying that now that we're in November, we probably should start thinking about getting a flu shot if we haven't gotten it up to this time, because it takes about 2 weeks to get immunity to the flu. We don't know if by Thanksgiving it's gonna get worse or not, and so it's I figure that I'm probably getting a flu shot every year, so hopefully I'll have immunity whatever comes along.
Hopefully.
I think that those are the main issues. Yeah, the pertussis or whooping cough is certainly something we have to be aware of. You know, there are vaccines for that. I've seen whooping cough, and when I was still in practice, even in the elderly. And so it's well, their immunity has waned because they haven't been exposed to it, and then their vaccine has been waned. So it's and other note was there's CDC noted there were 12 cases of Legionella pneumonia on cruise ships, so from hot tubs. And so if you go on a cruise ship,
I remember that in January when I'm floating around.
stay away out of the hot tubs.
Huh.
Yeah, so and then they're also recommending a second, COVID vaccine for seniors who are immune compromised. People who have some kind of getting chemotherapy and they're immune compromised from that. And so I'm sure these people need to talk to their physicians and get this done. So that's about all I have.
Well, thank you for giving us that update and that report. All good information for us to have. So with that, we will move on. Our next agenda item is discussion and possible action regarding budget amendment recommendations.
All right, this is on all the agendas. Just as we're working towards our last phase of next week county board on passing our budget, just in case there's anything else that comes out of left field or amendment to get added to the budget. So right now, staff is working diligently to work with bond counsel on our final documents on getting all that together. With that, so that's why this item is in the agenda. Right now, things are looking good going forward.
Supervisor Olson.
So can I ask a general budget question?
You certainly may.
So,
Best answer.
so how are we defining improvement in our garbage resolution that we passed at the last county board? Because there's considerable concern, at least in my part of the county, that we're gonna have a lot of people who are gonna be paying $100, $150, maybe $200 in recycling, because I know of numerous locations where their house is on one lot, their garage is on another lot, the shed is on another lot, and maybe they own 5 or 6 acres.
So I'm gonna jump in here, Supervisor Olson. I apologize that this isn't the appropriate committee to address that sort of budgetary amendments for this committee would be related to Health and Human Services. While I'm not taking an opinion on your question or anything like that, I think that issue is better addressed at a different committee where it would be more greatly noticed for the public to be able to come and make a statement on it. Again, I have no opinion on your request. I think that we should limit our discussion of amendments and possible amendments to the budget to issues related to health and human services.
Another question that's related. I think this is the simpler one. If a motion is made at the county board to reconsider an amendment, does that motion of reconsideration, does that have to be on the agenda?
Is that question to me?
I think so.
So
I wouldn't know.
you're asking whether or not a motion to reconsider resolution that's already passed would need to be on the agenda. I'm not sure. I can look into that. And if it does, we can certainly work to get that on the agenda.
Okay. Good enough.
And I can answer your question after the meeting if you want to.
Okay.
Supervisor Bonneprice.
Mr. Olson, I think in the past you are correct, but it has to be a 2/3 vote. Then I think it would.
We'll have work clarifying that for before the county board meeting and getting those questions answered.
Good question.
With that, do we have any other health and human service related budget amendment recommendations? It would appear that nobody has anything for us. And so with that, moving on to agenda item 14, administrator update.
I don't have much of an update. We are working on solidifying the library committee. There'll be appointments made at the county board for that. I have not gotten the latest numbers yet for the sales tax for the last month. So that's all I have for my report. Very, very short as we're working on the budget.
Okay. Oh, thank you for that. Not to rush things along here, but gosh, we're just moving moving right along, aren't we? Okay, agenda item number 15, our legislative event report. Supervisor Bonaprise, do you have anything for us?
Not a lot, being there isn't, it's a lame duck session. I had a steering committee meeting here. I came 2 weeks or a week ago last Friday. The big discussion again was on housing, general housing for one thing, and housing for the mentally, that's been going for years. I guess one notice is April in Madison. Is it the 11th or the 17th? I got the note out.
Probably the 11th
I think it's the 17th.
for the Human Services Day.
Yeah,
Is that what you're at the Capitol?
yeah,
It's one of those
yeah.
in April.
I got the notes I took down
Okay.
out in the truck. But yeah, they have a Human Services Day at the Capitol. I know I attended that twice. And you go to the rooms of all our representatives, and you really, I think it's important that we have somebody down there, because we've always got things that we need to be at the table for. And at the table, you don't get any recognition, and it's very helpful to have some people down there. And they've always been very cordial. And
So I don't know what the date is, if we want to keep our committee apprised the dates. Tanya, what do we usually do with that?
So we take a team down of administrative people, and so Wisconsin County Human Services and Wisconsin Counties Association kind of preps the discussions for us. But what we do is bring it back to a local level and we are prepared to tell our legislators how it impacts us in Polk County. So we schedule our meetings. We try to do one meeting for all of our representatives so that we can just be super efficient with that. We always encourage committee members and board members to attend with us. We will provide transportation and accommodations to get you down there. But we always go for sure. So.
Well, I for one would be interested in attending, provided I don't have any
It's very beneficial.
scheduling conflicts.
there was one year I was down there, we went together with St. Clair County, and we discussed a resolution that we wanted on our steering committee, which I did. And you can gather some support for some local issue that way, and that's the process, and it works very well. It's about the only voice we have.
Madam Chair, I would also be interested in attending, depending on the date.
Yeah, awesome.
Yeah.
Okay.
I believe it's the 17th.
Okay.
Sounds great.
More to come on that then.
Yeah, more to come.
Mhm.
Do we have anything else? John,
Legislatively.
legislatively, it doesn't appear that we do. Agenda item number 16, to identify subject matters for our next meeting on December 10th. Where is the year gone? Something I'm interested in, and I don't know if it needs to be an agenda item or not, but I guess I was hoping for an update from the committee that is working with the mental health, the ad hoc committee.
Yep.
I'd be interested in an update on that. Do we have anything else? Otherwise, on our work plan, if we take a look, we have a division update. We consider what we're going to look at for 2025. And then is this meeting potentially to be held at Golden Age Manor?
Yes, and we've already cleared it with Dana. She's good to go.
Okay. Okay, that sounds great. Anything else for
Do we
that
have a
meeting?
date on that?
December 10th?
Oh, our meeting is gonna be,
Yeah, our meeting will be December 10th at Golden Age Manor. Same time?
Yes, same time.
Same
Yep.
time.
Mhm.
Okay, so 9 a.m. on December 10th at Golden Age Manor. We have anything else potentially for agenda items for that meeting?
We could do a program review if there's an item that any of the committee members are dying to know about,
Okay,
wanting to know. Pam, do you want to?
Not off the
You
top of my
put
head,
pressure.
yeah. Pressure, no pressure, come on.
okay, well,
I'll-
also if, if something comes to you later,
Good at it, yep.
a program item, you can let Tanya or I know, and, we certainly are going to be amenable to putting that on the agenda. Okay, with that, if we don't have anything else, I will entertain a motion to adjourn. Any discussion? All in favor, say aye.
Aye.
Opposed? And motion passes and we are adjourned.
Oh, I do the math because that's just.